Welcome everyone to the first part of this webinar series on boosting the immunity of healthcare businesses with smart analytics. I am Harshdeep, part of analytics team here at Grazitti. With me is Sapna, who manages our analytics team. Hi Sapna.
Hey there, Harshdeep. Thank you for joining us, everyone. Let's get started. As we are aware, governments, businesses, and citizens around the world are making a Herculean effort to contain and defeat COVID-19. In fact, we all have been working from home for the past few months to contribute to keeping our communities safe and businesses growing. However, health centers form the front line in our battle against COVID-19. So big round of applause for them. So today we are going to learn more about analytics, how analytics can help make revenue cycle management and clinical population health management more effective. So before we begin, here is a brief introduction to Grazitti. Grazitti Interactive is a global digital services provider with out-of-box analytics solutions, including healthcare analytics, data warehousing, Alteryx custom connectors, and machine learning. Grazitti helps healthcare providers better manage revenue cycles, clinical and population health, human resources, as well as operations and supply chains. Now let's look at how smart analytics can help you deliver improved patient care and business success.
Here are the topics that we will be exploring today. First, let's take a look at latest global COVID-19 trends with Grazitti's Tableau dashboard. The data is updated as of yesterday. As you can see at the top right corner of your screen, the data we have here is from January 22nd to yesterday. It is updated daily with latest statistics on COVID-19 cases. Now, at top of your screen, you will see the summary type. Here you can get to know the total number of confirmed cases, recovered cases, and deaths, as well as those reported in last 24 hours. Below this tile, you can see the number of active cases, the percentage increase or drop in confirmed cases, recovered cases, and deaths since yesterday. With this, you get a clear picture of the spread of COVID-19 across the globe. In addition to this, you can better understand which countries are worst affected with the world map. As you can see, the US is the worst hit till date. The chart to the right shows data from the last 30 days with regard to the daily trend of confirmed cases, active cases, recovered cases, and deaths. You can filter this data by year, quarter, month, week, or day as per your requirement. Below the world map is a table with the case to death and recovery ratio for the top 10 worst affected countries. While the default view is set to top 10 worst affected countries, you can also input the number of your choice to view more countries. To the right of this table, you can see new cases versus recovery versus deaths in the last 24 hours by country in the form of a bar graph. And finally, at the bottom of your screen, you can see a weekly comparison of the infection growth rate by confirmed cases. Before we go to the challenges that healthcare businesses face, let's look at what a strategic data acquisition roadmap should look like. Now, the data that healthcare businesses collect has almost no information about healthy patients who rarely happen to visit health centers. Therefore, in order to build a strategic data acquisition roadmap, it is essential to collect all relevant healthcare data. Such a roadmap should include data about healthcare encounters, claims, biometrics, as well as patient-reported outcomes. It should also include consumer, socioeconomic, genomics, epigenetics, and microbiome data. Sapna will talk more about the challenges there.
Let's begin with the fact that healthcare lags behind other major sectors in leveraging data. Most healthcare organizations have not integrated analytics into their regular operations. In fact, 56% of the health centers do not have a strategy for data governance or analytics. When a review of systems was carried out, data in the electronic health records did not reflect reality 61.1.5% of the time. The electronic health records did not reflect reality 47% of the time with regard to physical exam. This means that electronic health records are inaccurate with regard to physical documentation. In addition to this, healthcare data is split amongst various entities as well as in different formats. This makes it difficult for healthcare businesses to build a detailed database to get actionable insights. This also leads to an increase in the cost involved in leveraging data, even in the cases where the relevant data is on record in some form. Another major challenge that healthcare businesses face is that of data quality. The ability of healthcare providers to drive decision making with the data depends on the extent to which they can extract and utilize quality data. It is well said that along with the challenges, a crisis also brings opportunities. While COVID-19 is putting massive strain on the global healthcare system, it is also driving innovation in healthcare. Health centers are leveraging data visualization to track the outbreak of the pandemic, raise awareness, and to help stop its spread. As the global situation evolves rapidly, healthcare leaders are likely to increasingly make the use of real-world data regarding important decisions aimed at minimize the impact of COVID-19. In fact, the ability to learn from past and current real-world data will have a major impact on our ability to track, control, and understand the pandemic. The 2020s may as well be remembered not only for the outbreak of COVID-19, but also as the decade when digital transformation became the mainstream solution within healthcare business. Now let's go through the challenges involved in revenue cycle management and the approach we took to make it effective for healthcare CFOs. Effective revenue cycle management or RCM is also a concern for healthcare businesses. So here are some data facts. 26% of the claims are rejected outright. 40% of the rejected claims are never resubmitted. And 10% revenue loss has become a new norm in the healthcare industry. So furthermore, with standardization, you can simplify the billing process and focus on the delivery of quality patient care. So let's look at some of the real challenges that healthcare businesses face with revenue cycle management. So here, CFO's biggest challenge was to plug the revenue leakage. They were unable to see if payers pay or issue a denial. They were unable to track or identify the payers responsible for growth and the drag of business and revenue. Next, the challenge was irregularities across insurance types, which means unable to distinguish what type of insurance is paying on time and who is the laggard. Claim denials and follow-ups for rejected or unpaid claims were an issue as well. They wanted to track how long do the charges stay outstanding and what are the key reasons for denials. They also wanted to see what kind of ICD or CPT codes are getting denied. Another major challenge was complex patient billing and claim life cycles. In addition to this, there were long gaps between the delivery of care and payments, which posed a challenge. Uncertainty over amount a payer will release for a particular service was an issue as well. However, they were carrying out intensive manual follow-ups with the payers to track all the claims and payments. RCM also involved heavy data processing and complex calculations. Therefore, they had to assign a significant percentage of their workforce to perform these operations. So now that we have looked at the challenges in implementing effective revenue cycle management, Let's take a look at the approach we followed to help our healthcare customers manage revenue cycles with smart analytics. So very first step, we pulled the patient, appointments, encounters, charges, payments, and claims data from electronic health records and built a data warehouse. By storing all the historical information, customer was able to better analyze the data over a specific period of time. So with the data warehouse in place now, we built a reporting and triggers to leverage analytics for effective revenue cycle management. RCM Analytics helps optimize financial processes the healthcare facilities use. It helps healthcare authorities to understand the overall revenue cycle and highlights the performance of claims or processes. The RCM Analytics solution helped their customers with the reports about patient billable visits, AR management, coding distribution, charges, payments and adjustments, charge liquidation, and denial management. I'll walk you through the dashboards in future slides. Now let's have a look at the results our customer was able to achieve after following the smart analytics. With the RCM Analytics solution in place, the customer is now able to reach out the payers in advance. This solution has also helped them in getting faster payments. In addition to this, customer has been able to optimize revenue and plug leakage. They have also been able to minimize monthly patient denials. The customer has been able to reduce the time taken in patient eligibility verification. They have also been able to reduce outstanding account receivables. RCM Analytics has also enabled the customer to accelerate charge captures. They have been able to optimize reimbursements as well. So now let's take a look at the use cases for RCM Analytics. So now I'll walk you through the live dashboards we built for our customers. So here is the one on your screen, patient billable visits. So in this instance, analytics enables you to keep a pulse on your healthcare business. You'll see the top filters on each dashboard to check the metrics by each financial class, site, month, year, and provider. Also, by double-clicking on each visual, you can filter the entire dashboard data. So here we are filtering the dashboard data on the basis of financial class medical. So rest of the visuals on this dashboards are now displaying the data with respect to medical. First two charts are showing actual versus budgeted hours for each financial class and monthly spread for a specific fiscal year. So by default here, fiscal year is the current year. On the right hand side, we have charts showing running total of variance between actual and budgeted, and the below pie charts showing total patients and their visits for each financial class. So this dashboard also helps in monitoring actual performance against the predefined goals for visits categorized by financial class, site, and providers. So you can also plan and optimize budgeted visits for the upcoming tenure. So now coming to the next dashboard, AR management. So AR here stands for account receivables. This dashboard helps you to keep a close eye on the claims paying cycle. On the left hand side, you can see AR summary chart. It highlights the claims that are unpaid, also called aging reports, which shows pending payments for slots such as 0 to 30 days, 31 to 60 days, 61 to 90 days, and so on. In addition to this, you can also view insurance payment timelines for various payers. Furthermore, it shows you the insurance company's backlog and expected delay in the payments. On the right-hand side chart, you can view the list of top 10 financial classes for each slot. On the two bottom charts, we have tabular representation of data for the aging and account balance category. This data enables you to reduce the manual work involved in multiple departments to monitor AR. Furthermore, with the help of this dashboard, you can monitor the effectiveness of AR strategies to improve collection rates. Now moving on to the next dashboard, coding distribution. So here analytics help you measure the performance of coding distributions and view high performing medical services. In addition to this, as shown in the pie charts, you can distinguish the number of new and established patients for each CPT code. Analytics also enables you to track monthly patient visits as well as visit trend by new or established patients, according to the severity of care level and other CPT codes. With the analytics solution implemented here, you get a concise information about new or established visits for each CPT code and can identify top 10 ICD codes based on the patient visits, which is highlighted here in the bottom right chart. Now moving on to the next dashboard, which we have around charges, payments, and adjustments. In this case, you now have a consolidated dashboard with charges, respective payments, as well as adjustments for a given fiscal year. In this dashboard, the top pie chart is showing the annual distribution of charges, payments, adjustments for the specific fiscal year. Also, you can keep a track of the remaining charges which are there in the center of this donut chart. And the bottom stack chart is showing the monthly distribution for all charges, payments, and adjustments. In addition to this, there are 3 actionable icons on the right-hand side, which enables you to further drill down the 3 measures: charges, payments, and adjustments respectively. With this analytics solution implemented, you can view health center revenue and distribution pattern on a monthly and annual basis. Furthermore, with the help of this, you can minimize patient denials as well as revenue leakage. Now moving on to the next dashboard, we have charges liquidation. It shows you a diagonal chart for cash flow by month. You can track the total number of charges, payments, and adjustments. It also helps you compare the gross collection ratio, that is GCR, and the net collection ratio, that is NCR. This data enables you to get stronger insights into your cash inflow for each month. So now moving on to the next dashboard, denial management, very important one. So this helps you to showcase all the KPIs related to denials. It enables you to understand the reasons for denial, such as missing information, incorrect patient demographics data, and all the technical errors. It shows you the details with regard to duplicate claim submission and the services which are not covered under claims. This data helps you identifying outstanding charges and improve denial management. And it also helps you in minimizing the revenue leakage. So in addition to this, you are able to increase the organizational revenue and collection rates by improving patient satisfaction. So now that we have a clear understanding of analytics for effective revenue cycle management, Harshdeep will take us through analytics for clinical and population health management.
Thank you, Sapna. Effective clinical and population health management is also a concern for healthcare businesses. With analytics for clinical and population health management, you can track patient visits, behavioral analysis, reduce medication errors, and strengthen clinical decision making. Analytics also helps you find meaning in real-time or historical data, enabling you to make predictions and improve the probability of success. In addition to this, analytics helps you keep a pulse on your business so that you can drive decisions with data and optimize processes and results. Let's now look at some of the challenges that healthcare providers face with clinical and population health management. A major challenge for healthcare businesses is reducing medication errors. Providers can also find it difficult to implement clinical decision-making. In addition to this, tracking behavioral metrics, obstetrics, as well as other services is an issue. Furthermore, it can be difficult for providers to evaluate and measure clinical performance against predefined goals and productivity levels. Moreover, strengthening patient engagement can be a challenge. Health data interoperability is another concern in clinical and population health management. In addition to this, healthcare businesses find it difficult to understand, such as which metrics to use, what data is required to satisfy these metrics, how they can turn raw performance numbers to make actionable improvements. So with little standardization across payers, federal regulatory programs, as well as other value-based care models, healthcare providers find it difficult to achieve value-based goals with overly complex quality measures. So now that we have looked at the challenges in implementing effective clinical and population health management, here's how smart analytics can help and the approach we took to help our healthcare customer with smart analytics. We took a three-pronged approach here. The first was to track the movement of performance indicators against predetermined targets. Second, we constructed a broader view of health center and provider performance. Finally, we implemented a real-time interactive analytics solution with multiple filters, focusing on location, provider, ethnicity, race, as well as gender. The CAPH analytics solution helped our customer with reports about patient flow and enriched planning, which ensured smooth patient flow, reduced the waiting period with a comparison of actual and budgeted visits by month and location. Physician and performance analytics, this helped in understanding performance trends for a particular site as well as quality measures. Quality and safety overview, this enabled customers to have a quick insight into patients' respective treatments across ICD and CPT codes. Next one was preventive care and screening. This supported our customers in providing personalized care to patients and identify patient population based on screening and unhealthy alcohol use, tobacco use, and cervical cancer. Population health metrics. This highlighted patients with ADHD, dental decay or cavities, and low birth weight babies. And here are the results our customer was able to achieve using smart analytics. With CAPH analytics solution in place, the customer has been able to optimize decision making. The solution has also helped them track and analyze patient behavior. In addition to this, customer was able to enhance the quality of healthcare. Now let's look at the use cases for clinical and population health analytics. Here is one for population health analytics. It shows you the demographic analysis of patients by way of gender, sexual orientation, race, primary language, location, ethnicity, and primary health insurance. It highlights the top 10 clinical measures such as child immunization, mammogram, and so on based on patient visits. In addition to this, you can identify clinical measures with the highest visits. Here you can see the total active patients by month. The chart at the bottom center shows you the number of patients availing different types of primary health insurance. As you can see, Medicaid tops the list here. And now the next one we have is dental analytics. This enables you to keep an eye on dental visits for multiple services and treatments, highlighting the most availed service during the selected time frame. You can also view appointments and monthly visit trends. In addition to this, you can view charge distribution details by month. The Dental Finance Dashboard enables you to view financial health. To view further details, you can click on the visual and go to Dental Finance Dashboard that shows in-depth analysis for charges, payments, and adjustments. So herein we had the detail about charges, payment, and adjustments for a further drill down into the financial health of business. The next one we have in line is behavioral health. This dashboard helps you monitor behavioral health over a period of time. It is segmented according to various diagnoses that the patient goes through, such as depression, alcohol screening, and ADHD. This dashboard enables you to keep an eye on behavioral health performance, capturing whether the treatment is effective or not by comparing patients' performance with standard goals. And finally, we have a use case for medical analytics. The aim here is to highlight medical illness or medical details for patients visiting your health center. As you can see in the dashboard, it highlights childhood and adolescent immunization compared to total patients visiting the facility. In other dashboard, you can view a detailed analysis for controlled BP and poorly controlled diabetes by number of patients, race, financial class, and ethnicity. So with this data, you can strengthen clinical decision making. Hence, Sapna will now conclude the webinar.
Thanks, Harshdeep. And that brings us to the conclusion of the first part of this webinar series on boosting the immunity of healthcare businesses with smart analytics. We hope that by now you'll have gained stronger insights into how analytics for revenue cycle management and clinical and population health management can help you deliver on improved patient care and healthcare businesses success. If you're wondering how to get started with smart analytics for your healthcare business, please feel free to reach out to us at www.grazitti.com or info@grazitti.com. Don't forget to join us for the second and the final part of this webinar series. Until then, stay healthy and stay safe. Thank you again for joining us.